Today we are going to discuss a topic on common health problems and objectives of school health service. Introduction. School is defined as an educational institution where groups of students pursue their studies at defined levels, receive instruction from one or well-qualified teachers. Whereas school health refers to a state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease or infirmity among the students, teachers, and other school personnel. On the other hand, school health services ideally refer to the need-based comprehensive services rendered to the students, teachers, and other personnel involved in the school to promote and protect their health, prevent and control diseases, and maintain their health. Therefore, practically it refers mainly to provide the basic necessary services to the students to promote and protect their health, control diseases, and maintain their health. Thus, the ultimate aim of school health services is to promote, protect, and maintain health of school children and reduce morbidity and mortality. So now, common health problem at school. Common health problem at school level are: number 1, malnutrition; number 2, infectious diseases; number 3, intestinal parasites; number 4, diseases of skin, eye, and ear; number 5, dental caries. So now we have malnutrition. Malnutrition is a state of nutrition in which a deficiency or excess or so-called imbalance of energy, protein, and other nutrients causes measurable adverse effect on tissue or body form, that is like body shape, size, and composition, and function and clinical outcome. Malnutrition can often be very difficult to recognize, particularly in patients who are overweight or obese to start with. Malnutrition can happen very gradually, which can make it very difficult to spot in the early stages. Some of the symptoms and signs to watch out for include loss of appetite, weight loss, tiredness, reduced ability to perform normal tasks, reduced physical performance, altered mood, poor concentration, and poor growth in children. Malnutrition in children, also understood as undernutrition, is common globally and result in both short and long-term irreversible negative health outcome, including stunted growth, which may also be linked to cognitive development deficits, underweight, and wasting. Lack of access to highly nutritious foods, especially in the present context of rising food prices, is a common cause of malnutrition. Poor feeding practices such as inadequate breastfeeding, offering the wrong foods, and not ensuring that the child gets enough nutritious food contribute to malnutrition. Now we have infectious diseases. Infectious diseases, also called communicable diseases, include any disease or illness caused by pathogenic microorganisms such as bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies. They are normally harmless or helpful, but under certain conditions, some organisms may cause disease. One can get infected by touching, eating, drinking, or breathing something that contains germs. Some infectious diseases can be passed from person to person. Some are transmitted by bites from insects or animals, and others are acquired by ingesting contaminated food or water or being exposed to organisms in the environment. Children are often at an increased risk for infectious diseases while their immune system are still developing simply because of exposure to diseases. Most children will have at least 6 to 8 respiratory or breathing tract infections each year. These include cold, ear infection, sinus infection, bronchitis, and pneumonia. Infections of bowel are also common. When children gather together in childcare setting and school, infections of the bowel are also common. When children gather together in childcare settings and school, there is opportunity for infection to spread from one child to another. Now we have intestinal parasites. Intestinal parasites are parasites that can infect the gastrointestinal tract of humans. They can live throughout the body, but they mostly prefer the intestinal wall. Means of exposure includes ingestion of undercooked meat, drinking infected water, and skin absorption. Intestinal parasites spread in areas with poor sanitation and are most common in tropical developing countries on the Africa, Asian, and South America. Parasites are very common around the world. The infections are transmitted in crowded places like daycares. Also, children in developing countries are usually carrying some types of parasites. Poor sanitation and unsafe water increase the risk of catching parasites. The most common intestinal parasite in children includes giardiasis and pinworm. Other parasites are also common in children living in developing countries where sanitation and hygiene are poor. These include ascariasis, amoebiasis, and tapeworm. Now we have diseases of skin, eye, and ear. Skin, eye, and ear disorders are extremely common among children. Diseases of the skin that lines the auditory canal can sometimes cause a kind of local swelling that block the canal and interfere with hearing. A child with an ear problem may have an ear infection which can cause ear pain and fever. If an ear infection is not treated on time, the eardrum may perforate and the child feel less pain. Now we have dental caries. Dental caries is an infectious communicable disease which causes destruction of teeth by acid-forming bacteria found in dental plaque. The most important concept to remember is that caries is a dynamic disease process and not a static problem. Secondly, before a cavity is formed in the tooth, the caries infection can actually be reversed. Dental caries is a major oral teeth problem in school children. Dental caries in children is typically first observed clinically as a white spot lesion The early manifestation of the caries process is a small patch of demineralized enamel at the tooth surface, often hidden from sight in the features of teeth or in between the teeth. The destruction spread into the softer, sensitive part of the tooth beneath the enamel. The weakened enamel then collapses to form a cavity and the tooth is progressively destroyed. If the tooth surface remains intact and non-cavitated, then remineralization of enamel is possible. If the subsurface demineralization of enamel is extensive, it eventually causes the collapse of the overlying tooth surface, resulting in a cavity. After this, we have components of school health services. Components of school health services comprises the following categories. Number 1, health promotion and protective services. In this, we have wholesome school environment, maintenance of personal hygiene, nutritional services, physical and recreational activities, promotion of mental health and immunization. Number 2, therapeutic services. In this, we have health appraisal, treatment and follow-up, first aid and emergency care, and specialized health services. Number 3, rehabilitative services, that is care of the handicapped students. After this, number 4, school health records. Now we have school health team. In order to run school and implement the school health services effectively, the school health team should consist of the following persons. Number 1, the school principal. Number 2, school teacher. Number 3, the parents. Number 4, the community. Number 5, the children. Number 6, the medical officer. Number 7, the school health nurse or community health nurse. After this, we have objectives of school health services. The main objectives of school health services are as follows. Number 1, to promote positive health among the school children. Number 2, early detection, treatment and follow-up measures of defects with various health problems of school children. Number 3, to maintain a comprehensive health record system. Number 4, to access the health status of students. Number 5, to develop healthy attitudes and behaviors of students. Number 6, to awaken health consciousness in children. Number 7, to ensure a healthy environment for children at school. Number 8, to plan and implement a program of prevention and control of communicable disease in accordance with regulations. Number 9, to provide health counseling and instruction for students, parents, teachers and staff. Number 10, to provide health education for school personnel and parents. Number 11, to develop and implement an emergency care plan. After this, we have activities of the school health services. Activities of the school health services are as follows. Number 1, prevention and investigation of communicable diseases. In this, we have health education of school personnel in order to be able to take the necessary measures to prevent viral meningitis. And in case of an outbreak of a communicable disease, the health visitors apply the necessary measures in order to prevent spreading of the disease. Next, the health visitors cooperate with other health professional for the investigation of certain communicable diseases such as viral meningitis and tuberculosis. After this, we have vaccination. The health visitors give to students the routine vaccinations according to the existing vaccination program of the Ministry of Health. The student as well as the parents are informed about a certain vaccine that will be given. In order to vaccinate a student at school, it is necessary that the health visitors takes the parents or guardian a written consent. After this, we have health education. Health education is provided by both health visitors and school doctors. The main purpose of health education is not only to give students the knowledge but also the skill to develop and adopt a healthy behavior. According to the international literature, health education programs which involve active participation of students in education are more effective than lectures. Based on that, 2 educational program courses for students of the secondary schools have been applied since several years now. After this, we have educational program courses. For quite a few years now, the health visitors have applied 2 educational health program courses for the secondary school students. One is the educational anti-smoking program course for the student attending the first year of secondary school, and the educational program course for the prevention of HIV/AIDS and sexually transmitted diseases for students attending the last 3 years of secondary school. The main characteristics of these program courses are the training of some key students who in turn take over the training of their fellow students. Now we have anti-smoking educational program. The peculiarity of this program is based on the fact that health visitors train 2 students from each group. When the training is completed, 2 students undertake to present the lesson in the presence of health visitors to their fellow students. Now we have the aims of program. The aim of the program is, number 1, to offer some knowledge on the consequences of smoking on human health and generally to the human life, that is financial consequences as well as social and environmental consequences. Number 2, to provide awareness that through games and acting roles, children develop a healthy attitude and behavior. At the same time, they acquire those abilities which are necessary for a young person of their age to resist the challenge to smoke. After this, we have anti-HIV/AIDS educational program for students. An anti-AIDS educational program can be applied to the student from time to time. The scope of this program, which is carried out by means of dialogue, games and through acting role, that is to offer the student some knowledge on AIDS and sexually transmitted diseases so that they would be aware of the methods of contamination and protection, and they would learn about the methods by which virus is not transmitted so that they do not have false phobia about HIV people who are HIV positive. Number 2, the development of healthy attitude, behavior and acquisition of ways of resistance through various exercises are carried out. Next, to increase the children's sensitivity to the consequences of AIDS. After this, we have organizing healthy breakfasts. The health visitors, in collaboration with the school management team and the Parents Association, organize the serving of healthy breakfast in primary schools. An educational course regarding nutrition in general and the importance of breakfast in particular always precede the actual serving of the meal. So now we have conclusion. School health services provide the basic necessary services to the students to promote and protect their health, control diseases, and maintain their health. The main aim of school health services is thus to promote, protect, and maintain health of school children and reduce morbidity and mortality in team. The common health problems at school levels are malnutrition, infectious diseases, intestinal parasites, diseases of skin, eye, ear, and dental caries. School health services are taken up through various activities such as prevention and investigation of communicable diseases, vaccination, health education, and various other educational program courses.